Hello, everyone. Welcome to 5 Minute Videos, study for the NCE. We are in Area 3, Clinical Focus, and today we're going to be talking about Sub O, which is intellectual functioning issues. So, intellectual functioning um, is a term that is used in the Diagnostic Statistical Manual 5. um, and what they labeled as functioning issues, or the DSM has put it as deficits in intellectual functioning, is reasoning, problem solving, planning, abstract thinking, judgment, academic learning, and learning from experience. So those are, I guess, what we associate with intelligence or intellectual quotient. And when the DSM 5 states that there are deficits in intellectual functioning, then that is normally or typically confirmed by clinical evaluations and individualized standard IQ test. So those are the things that a diagnostician or a psychologist or someone with experience in those type of battery assessments would give to the individual in order to determine the deficits of intellectual functioning. And those determinants are then used to see if certain criteria is required following the DSM characteristics of in intellectual functioning, and kind of what um, they stipulate. Now, it's important to understand that the intellectual functioning can have various degrees, and that's why using multiple assessments and having multiple observations are something that um, would be advisable, especially when looking at those types of disabilities or disorders, in order to kind of make that type of diagnosis. Now, other things to consider as with intellectual functioning is the culture, the age, how they're functioning within their society. Those are all usually steps that one would consider for such deficits, and kind of the implications with the intellectual functioning, and looking at the different types of things, such as reasoning, problem solving, planning, abstract thinking, judgment, academic learning, and learning from experience. Those are all very abstract concepts, so again, it's important to understand what is the functioning level, what are the social cultural standards, what are that individual's kind of circle, and how well are they functioning within that circle. So all of that is important, and then once those diagnosis or criteria are met, then it's important to look at the type of treatment planning for those functionings, and kind of how to best adequately meet the needs of those intellectual functionings. For some individuals, especially, when you look at some of the more severe, then you really want to consider, the notion of living with those types of functionings, and or what in the field they call intellectual disabilities, and kind of what would be realistic within their community, or their lifespan. So those are some things to keep in mind whenever looking at the notion of intellectual functioning, and kind of how all that can play a role in someone's day to day living.